Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
It's that season. Football, soccer, lacrosse, youth sports are not only growing at a rapid pace these days, but they are becoming more competitive, which can take a big toll on a young body. Here to help keep your child in the game is Dr. Sue Hubbard, award-winning pediatrician and medical editor for KidsDoctor.com, and Dr. Dustin Loveland, a pediatric orthopedic surgeon with Children's Health, Andrews Institute in Plano. Thanks for coming in. This is a timely subject. Kids as young as 3 these days are playing sports. Is that healthy?
You're right. 45 million young children and adolescents participate in competitive sports now in the United States. And we're seeing them younger and younger. So I see 3-year-olds playing flag football, 5-year-olds playing lacrosse, little girls in competitive gymnastics. And they're in the throes of musculoskeletal development. They're young. So it sets them up for injuries.
So are you seeing a lot more parents bring kids into the emergency room, or what's happening?
Absolutely. We see more parents seeking emergency room care and also coming into our offices, and that's why we are so fortunate to have someone like Dr. Loveland, who is the expert in sports medicine and pediatric orthopedics.
Okay, so for parents out there who are watching, and let's say you got a 4 or 5-year-old who's playing soccer or whatever. I mean, I remember when Michael did. What are the most common sports injuries that you see?
We're seeing a lot of mild injuries like sprains and strains and things that can be treated either on the field or get them back early, but that leads up to things like broken bones, ligament injuries, ankle sprains, and we're seeing a lot of stuff that sometimes needs referral, either a visit to the pediatrician or even a visit to a specialist.
Okay, so you don't want your kid to be the sissy, so to speak, but what do you do if your kid is injured during a game? What's the best way to treat it?
I think it depends what happens. And again, if they're injured on the field and there's immediately swelling or they have loss of consciousness, they need to be evaluated at that time on the field. And that may mean a trip to the ER. Otherwise, I think you can usually wait till morning, and there's certain things to look for. And Dr. Loveland is, again, can speak to us on that.
Right. So in high school sports, we have doctors on the field, we have athletic trainers. But in these youth sports, the sports medicine specialist is the coach or the parent. And so we talk about things on how to treat these on the field. We all know RICE, rest, ice, compression, elevation. With this uptick in fractures, especially in this young population, we've added a P, so it's PRICE, which means protect the area, whether that's a splint or a sling or something to prevent further injury before they're seen.
I remember Michael getting smacked in the head with a baseball bat. I've still got the picture of the crack in the head at the time. When is it time to go to the pediatrician when you get an injury of any kind?
I think if it's an injury where the bone is not sticking out, because I had 3 athletes too. And
I know you did.
And they had broken wrists. And I was like, Mom, we need to go to the ER. I'm like, you're going to be fine till morning. We're going to give you some Advil. We're going to ice it and rest it, and we're going to go be seen in the morning. Absolutely, if something's dislocated, it's really swollen, and the bone is sticking out, a compound fracture, you must be seen then. But there are many things you could see me in the morning, and I could call Dr. Loveland by the afternoon and get seen.
So you mentioned a compound fracture. When do you go see an orthopedic specialist?
If sometimes overuse injuries, things you've been dealing with, things you've seen the pediatrician for, you've tried as much conservative management and you just need a more specialized opinion, then you're certainly welcome to come see us. Concussions, we see many local pediatricians handle concussions. We also see them Monday through Saturday. So things like that can get in pretty easily.
So here's a question a lot of parents would like to know. Is there anything you can do to help prevent sports injuries?
Certainly things, especially in the youth group, is going to be hydration, stretching prior and after. And then things like overuse. Like if you're playing year-round the same sport, using the same muscles, you're going to have these overuse injuries. So put down the baseball, pick up a football, and just switch it up a little bit.
I've heard that sometimes it's better to alternate and have different sports at different times of year.
You don't want to specialize too young.
Okay. One final question. How do you know if a child needs to be evaluated before returning to the field? What are your clues?
In this group, I don't trust swelling. So swelling of the knee, swelling of the ankle, I don't trust that. Limping, they're probably not going to be at their best out there anyways. There's no point in being a hero at age 5 and hobbling out on the soccer field. Like, just let them rest and get them out and get them treated.
Okay. Thank you so much.
Both
of you for coming in today. You can visit childrens.com/Andrews for more expert advice on keeping your child in the game. You can also follow Children's Health and Kids Doctor on Twitter and, of course, on Facebook. Thank you all for being here.
Just like you're always by your child's side, we're Children's Health. and we're by your side. Visit any of our 40 locations for exceptional pediatric care.